We are live on YouTube. Now we're gonna try to go live on Facebook. Always takes a few seconds. And we are live on Facebook and live on YouTube. Welcome everybody. It's 12:30 again on Thursday. I don't even know what day it is. The 25th, I believe.
It is.
I can't remember. It changes every day, you know. We have an exciting podcast again with a special guest. Today we're going to talk about massage therapy, and massage therapy actually saved the life of our guest. I will introduce her briefly. But I also think that for most people, massage therapy is known as let's go massage at the spa. And massage therapy is so much more, because massage therapy really is a therapeutic application. It can really help with chronic pain, with all kinds of musculoskeletal issues and diseases and injuries. And so we want to focus more on the strategies and the techniques that licensed therapists use to really help you from a medical point of view. And so today we have with us Kat Jankowski. Hi Kat, how are you?
Good, how are you?
Good, I'll introduce her. She's a licensed massage therapist. She's also a certified personal trainer, functional movement therapist. She also has a bachelor in business, and she is in trying to obtain here soon her master's in kinesiology, right?
Right.
Good. She owns her own therapy place called Nirvana Wellness here in Palm Coast, Florida. So check that out. We will give you the website, etc. later. She also is the head instructor of the massage therapy program at Daytona State College here in Daytona Beach. She trained in manual therapy and manual techniques for over 7 years. She does a lot of research. She has a lot of advanced certifications. She has a lot of experience, and therefore she's one of those therapists that just doesn't give that good feeling massage and tries to get away of some muscle soreness or some symptoms, but she really emphasizes the cause, or trying to get to the primary cause of the ailment, of the symptoms, to really address the cause and obviously have long-lasting results versus, oh, this felt good, but 15 minutes later you're back in pain, right? So that's really what we want to talk about today. Now, Kat, massage therapy did save your life. So why don't you share your story with us on what happened and how did it save your life?
So about, I don't know, maybe 2013 or so, I started in a manual-based physical therapy clinic as a technician. And the owner of that clinic actually was a massage therapist at one time, and then he was a PTA. And, you know, I went in for numerous orthopedic conditions. I've had so many different breaks in bones and disc issues going on. And so
did you play rugby? What did you do? You were just rough?
I just know, just injuries and car accidents and just, you know, wear and tear and just doing unnatural things to your body.
Okay.
When it comes to sports also. And so I was a wreck. I didn't know what to do with my life. You know, I was, you know, a chef at one time, and I'm like, what am I supposed to do with my life? Like, this is not working. You know, 70 hours a week in a kitchen, night, weekends, holidays, just, it was killing
And you were
me.
in constant pain?
All the time, constantly all the time. And so I actually got sent to that clinic for physical therapy. And at that point, I enjoyed it because patients were having results. You know, they were coming in with pain. It wasn't like a hospital where you go in with an ailment and then you're kind of ran out like cattle. This was a little bit different. And so I actually obtained a job there, and I was there for 7 years. And in that 7 years, I went to massage school in hopes of transferring in to become a physical therapist. And it completely changed my way of thinking. It helped eliminate the pain. It actually showed you different ways on how the body actually works and how you're supposed to move. And so in turn, that's kind of where I'm at. It saved my life from where I was.
So you did, for yourself, you did receive a lot of massage therapy while you went to school, and it really turned things around for you.
Right, definitely.
And so without conventional medicine and drugs, you're all good now?
Well, yeah.
You're still beating yourself up, probably.
Yeah. And right now I take education I pick education that's going to help me. And so in turn, I can help my clients, because everything that my clients have experienced, I've experienced.
You've experienced. You're a product of the product.
Right.
And because it worked for you, obviously you want to share it with so many other people.
Right.
That's excellent. Now, what conditions, when we talk medically, we know we can go for a feel-good massage, but what conditions typically can benefit really good from massage therapy?
Oh, geez. So basic chronic pain, of course, that's number one and foremost. Any unresolved pain, so unresolved knee pain, unresolved SI joint issues, unresolved cervical or neck pain. So all these different unresolved type pains are perfect for massage therapy, because usually unresolved pain is not where the pain is at itself. It's coming from somewhere else. And so I treat a lot of pelvic instability. I treat a lot of SI joint dysfunction, plantar fasciitis, cervical issues, headaches. So all these conditions can be helped with massage therapy.
That's excellent, because all the people go to chiropractors too, right? And they supposedly move the bone. Now, bones don't move by themselves. It's the muscles that move the bones, right? And many times when there's underlying issues, and I have a physical therapy license, so I can talk to Kat here. Many times there's muscle guarding and muscle imbalances. And so those muscles really need to be worked, need to be stretched, need to be, loosened up to get that circulation going. And when there's not attention to those muscles, nothing's going to happen. It's going to stay in that faulty, imbalanced position, correct?
Very true.
All right. What besides chronic pain? Is there anything else that you would say massage therapy can help?
Overall wellness, that's, 100%. I see anywhere from ages of 5 years old up to, I have a client who's 92. So, not only are they coming in for the feel good, but they come in for results. They come in because their posture is horrible and they have no way of correcting it. They can't correct it because, like you said, the muscles are so tight and restricted.
Adaptive shortens.
100%.
So, because I was going to go there anyways, because with this whole COVID thing going on, I'm coming out with my book on immunity. But when it comes to the immune system, a lot of people forget about our lymphatic flow and our lymphatic system, because our lymphatic system is what basically gets all our immune cells, white blood cells, throughout the body. And the lymphatic system is more like a plumbing system. That's how you can compare it. It cannot be clogged up. We need to keep it flowing. It needs to be clean, so all the waste can be, getting away from the tissues and the cells and the organs, but all the immune cells can get anywhere also. And so just as massage therapy stimulates the circulation, the blood circulation, it also stimulates our lymphatic system, right? So it's also good for immunity, preventative medicine, and those types of things, correct?
Because you have to remember that toxins are stored in the body, and they're usually not stored in muscle and healthy tissue. They're stored in unhealthy tissue. They're also stored in fat, so they're stored in your lymphatic system. So when there's any kind of ground substance that's kind of stuck and it's not moving, things aren't flowing, that becomes a toxic situation. So not only do you start having pain, you could start developing other things like autoimmune, and then you constantly getting sick, illnesses all the time. So it's really important to move that lymph throughout the body.
Correct. We talk on this show about toxemia all the time, right? The accumulation of toxins in the body, which is the cause of all disease. And so massage therapy is yet another way of mechanically, manually moving those toxins or dislodging those and having them excreted to the appropriate organs. What is chronic pain? Why is chronic pain so difficult to treat from a medical point of view? Because everybody has chronic pain. They go to the physical therapist. They go, obviously, they're on Percocet or hydrocodone or those types of medicines. And obviously, we know it doesn't work because they got to refill their prescription every 3 months and they got to keep going. And it's a vicious cycle of just more and more pain. So there's certainly no solution or a betterment in sight for those people when we talk about, conventional medicine. So what's the problem there, and how would you address that?
So chronic pain is a very sticky situation, first of all. Anytime you have pain, you automatically go into this pain cycle, right? That's pain, spasm, pain cycle. So pain, you kind of have to quantify like where pain is coming from. So is it a blunt force trauma? Did you have some sort of direct injury that's causing pain?
Like a car accident.
Right. Number two, is there a neurological hormonal imbalance that's now shooting off some kind of neurological sensing that you have pain?
Chemicals.
That's number two. Number three, do you have an emotional attachment to something that you have experienced in your life that now has produced a traumatic feeling in the body, so now you have pain? So anyone who has chronic pain, so we're talking 3 weeks or more of pain, you now have changed your postural alignment, you have now changed your daily activities, and now you have an emotional attachment. So if you ever see those people who are on long-term pain medicines, just the thought of them missing a dose, it erects a response, right?
Yes.
So now they're like, oh my gosh, I'm so scared. So anytime that you have chronic pain, you have to think about, is this pain or is this emotional? Like, what's really driving the pain? And until you break that cycle, the pain cycle, the emotional cycle, you're not going to catch it. It's kind of like chasing your tail. And for our medical system to cover up the symptoms and just throw a bunch of stuff at it and hope it works, kind of like throwing something at the wall, hoping it sticks. Instead of actually going to that direct point, what caused the pain, what emotion is attached to it, and how do we change it? It's more of symptom relief.
Sure, and we know that about conventional medicine, it's just managing the symptoms of the symptoms of the symptoms of the symptoms. So I assume that when you get a new patient, you do a thorough examination, not only, but an intake, talking to them to try to figure out where that pain may originate from. Correct?
100%. And usually, so if somebody comes in with chronic, let's just say, chronic plantar fasciitis. I'm not looking at the plantar fasciitis because pain is not where pain is. Pain is coming from somewhere else in the body, almost all the time. So you start at the spine, because that's where your spinal cord is. That's where the nerves run. So if you don't take a look at the spine, where the dermatome patterns follow, their postural alignment, misalignment, you're kind of going the same route that the medical facilities are doing. So you kind of have to look at the entire body as a whole, the postural alignment from the feet, the ankles, all the way up to the spine of the head.
No, and that makes a lot of sense. If you're talking about plantar fasciitis, the bottom of the foot, is that L5? And
L5, that's one.
I'm still there, so that's your sacrum, right? So you got to look where it may come from to all the different things. If it's unilateral, it may be a pelvic malalignment, right? If it's bilateral, it may be something else. Sure. So based on the symptoms, really, it's all about making the correct assessment. And when you make the correct assessment, the treatment's going to be effective. It's that simple, right? So a good therapist, physical therapist, massage therapist, even a chiropractor, when they take their time to figure out where the pain's coming from, they can apply the correct treatment and there will be long-term results. And so people need to spend time with you, and doctors don't have that time anymore, right? What modalities do you use in your clinic? What different modalities or therapies do you use to address the needs of your clients?
So, first and foremost is always my hands, right?
Sure.
So I trained for a long time with my eyes closed. I used to work with a blindfold on, so I could really hone in my palpation skills, because your eyes will lie to you, right? Your eyes will tell you something that you don't really see. Like you're in a desert, you think you see water, but you really don't. So palpation skills is 100%.
Is that something that they teach you in school? Because the first time I hear it, a massage therapist that trains blindfolded.
Well,
or is that just you?
No.
Because I know you're different.
So at Daytona State College specifically, we give them a couple hours with blindfold on so they can manipulate around the body.
Mm-hmm.
That was my choice.
Okay.
It was my choice.
And now you're teaching your students this too?
We haven't gotten there yet, but
you will.
We will be for
All
sure. And so hands-on is always number one.
Yes.
Depending on what's going on with them, if they have swelling, if they have bruising, if they are pain of, on a scale from 0 to 10, we're looking at 6 or above, I'm going to put a topical on them. So that's another tool that I have. I also use rock tape. Rock tape you'll see on athletes, like a lot of
rock tape.
CrossFitters, that's kind of where it originated, was like the CrossFit community, but you'll also see these athletes with the Olympics, colored tape. Rock tape is amazing because it acts kind of like fascia. And you can do so many things with it. You can support a joint, you can make a muscle fire, you can shut it down, you can decrease swelling, you can stop pain, you can align the posture. So there's a lot of
that seems like a whole therapy in itself, right there.
It really is. When you don't have time, when you have 15 minutes in between matches and I have pain, you do what you got to do and put some tape on.
It seems like that requires all of training too, knowing how to apply these
100%.
tapes for a certain purpose.
100%.
I don't know that stuff, but it's
Yes.
interesting.
And actually, rock tape follows Tom Meyer's myofascial protocols, like superficial lines.
And so I assume for posture too.
Oh, 100%.
Yes,
for sure.
I could use that right here.
You could.
You could. See, she already made a diagnosis here.
Also use cups. Cupping. Cupping's
cupping,
been around
okay.
for thousands and thousands of ages. So use cupping. I use tools. So ISTEM, instrument-assisted soft tissue manipulation. So scraping tools also. I use microcurrent. And microcurrent is similar to a TENS unit, but a little bit different. TENS unit runs on an AC, it's more muscular frequency. Microcurrent runs on DC, and it's more nerve frequency. So I'll use microcurrent on a nerve root pattern that also follows acupuncture points. So I take Eastern and Western medicine and put them together to get a better result. Because not every person that comes to you, they could have the same exact diagnosis of the person before, but they won't respond to the same treatment. So you kind of have to bring everything in together and hit them with everything you have to see what works and what doesn't.
Excellent. Anything else? Seems like you got it all there.
I know.
Do you have a little gym area there too?
I do some functional stuff. So, you know, correcting postural misalignments, especially the pelvis, is huge.
Through movement.
So I do postural and pelvic realignments with every patient.
Yeah. No, and I love that part because I'm still doing physical therapy. 50% of the patients I see are low back, and I don't even care. I just check the pelvic alignment and the SI joint. I lay them prone on their stomach. I do a hip extension. One leg doesn't go up. I just mobilize the sacrum, and boom, they can do the extension and the pain is gone. So many times it's just by putting that sacrum back in place and aligning the hips that, you know, years and years of suffering just go away. So that kind of keeps me keep wanting to do this, because it's just that one person that you can help in 10 seconds, right?
And it's really super important. So once you do any kind of postural correction, you have to reactivate, re-educate the muscle. So
or it goes back out of place.
Oh,
so you got to start stabilizing it.
So if you think about the spine as a whole, right, your abdominals, especially the deep transverse abdominal, will hold the spine in place. So the spine's not, you know, gyrating back and forth over the vertebrae. Same thing with the pelvis. If you don't stabilize the glutes, the pelvis is really going to do whatever it wants. So you really have to reactivate those muscles after you make the correction to say, hey, we're supposed to fire when you stand up.
And then reactivating, do you mean getting them stronger too?
Yeah, so a lot of manual reactivation. So firing those neurons so that when you force a movement on the muscle, it actually fires. And you do that not against gravity, and then you have them stand up with gravity. So it's different layers.
So it's a whole sequence of therapies that you do to fight that muscle and stabilize afterwards. Okay. Because I was just thinking strengthening would take several months to really see a increase in strength.
Right.
But with your techniques, do things go faster? When we talk about stabilizing?
They do go faster, but you have to progress. So everything should come in a progression, right? So you don't work on someone who was squatting and say, go squat now. That's not how you do it. You have to retrain their body and how they're supposed to move, because the body has now reconditioned, oh, let's squat like this because this is comfortable, and you know, we're getting around our dysfunction. So once you change that dysfunction, you have to now retrain the body how to do certain things. So it's baby steps. I do have college athletes that have severe atrophy, especially in the quad. Just a couple correcting the pelvis, you know, mobilizing the ankle joint and the knee, reactivate muscles, and now within maybe 3 weeks, the muscle has come back to the size of the other. So it's crazy.
Very interesting. How then it improves sports performance that 100%. Way. And many of the athletes are probably not aware of some of their weaknesses from that point.
No, because the body is a very
So now I gotta come because I still want to swim. All right, see what you can find. So we're already starting to see how, you know, Kat is not just a massage therapist that massages, right? There's so many therapeutic applications, and she has so many tools to really, you know, address the cause of many of those ailments. So besides what we learned already, what separates you from the average or regular massage therapist or practitioner?
My sole 100% practice is on coming up with the primary cause, the root cause. So if you don't get to the primary or root cause of anything in your life, whether it be pain, whether it be distress, whatever, you're never going to have a resolution. So with that being said, I have used my practice, and every client that I have, we have to find the primary cause 100%. So, you know, I love spas, but their job is not to quote unquote fix you. It's to help relax you and feel better, right? But like you said, you know, even when I get a relaxing massage or so, I get up in pain because my body doesn't want that. It wants to be fixed. You know what I mean? So it's just a lot of finding the very root cause of what's going on.
Excellent. Now, you mentioned earlier combining Eastern with Western medicine. You talked a little bit about the cupping, which is obviously an Asian Chinese application that is used today even by Michael Phelps at the Rio Olympics, right? But how do you combine Eastern and Western medicine in your practice?
So a lot of it is nerve root patterns. So like plantar fasciitis, right? L5, S1. So if there's an issue with plantar fasciitis, I'm going to check the entire line of where the nerve runs. Well, along that nerve root, there are also very specific acupuncture points. For instance, if you have sciatica, sciatica has very specific acupuncture points that run that line also. So if you don't kind of address both, you're missing some things.
Sure.
And like I said, not every one person is going to reciprocate healing by one modality or another.
Okay.
So
no, I love that. So how did you learn your acupuncture points?
Well,
Because there's many of them, I know.
And so actually using microcurrent, so I took a certification through Dolphin Microcurrent.
The EDPS.
Yes.
Okay.
Yes.
That explains it all. So that's how
Because
you know
I've
your
seen
acupuncture
people
points.
use it, you know, and one of my really close friends, Joyce, she used it and she raved about it. I'm like, what is this? And you know, I'm not a believer in everything. It has to work on me. I'm not going to use it.
Sure.
So I went to the certification class one day, and actually I was preparing to lift heavy, right? So do a small deadlift competition, preparing to lift. And I'd been training heavy all week, and my lower back was on fire. I couldn't sit, I couldn't stand, like I was so uncomfortable. But I'm like, I gotta go to this class. So I went to the class, and I'm in the chair, and I'm moving around, and I'm like, oh God, I'm gonna have to stand up, like I can't sit here. And you know, after the 3 hours of her doing her demonstration and reading from a PowerPoint,
Start treating each other.
she says, who in here has lower back pain? And the woman next to me, now I have sat back because I don't want to be called on. I don't like to be in the forefront. She's like, oh, she does. And I'm like, oh.
She got you up there.
She did. And so she called me up there and, you know, lower back pain. She's like, bend over and touch your toes. My hands went a little bit below my knees. She worked on me for maybe 3 minutes and completely touched the floor.
Yeah.
I was sold. So from that point on is when I started to get more in tune with acupuncture itself.
No, I think it's great. Obviously, I have a license in acupuncture. I went to school 3 years for acupuncture, but then I did a CE course on the ETPS. I did it a few times because guess what? It counted for my CEs for physical therapy and acupuncture, so it was a good course for me to take. But to me, I really didn't need it because I had the needles, but who likes needles?
Right.
Number one. And number two, if you don't have an acupuncture license, you can do it. So I have a lot of physical therapy students that come, even from Belgium. And so I teach them the ETPS because you don't have to insert a needle. Anybody, any therapist can actually use this modality, but you got to learn your acupuncture points. And often, like you said, it's only just a few minutes on a certain distal point that can resolve an issue pretty fast. I use gallbladder 41 on my foot for a headache, a frontal headache all the time. It works all the time too. So that's certainly a great modality. And do you use those references then for your manual therapy too? Like if somebody comes in for low back pain, you work on acupuncture points in their feet, etc.
Oh, for sure.
Exactly.
Especially in the hip.
Yeah.
100%.
Very good. All right. What are some of the surprise issues that your method of treatment has been able to resolve?
A big one is unresolved medial knee pain. So I have quite a few clients who have long-term medial knee pain, and it comes and goes, right? So they go to the doctor, they get an X-ray, there's nothing wrong. They get an MRI, there's nothing wrong. Well, let's do an orthoscopic surgery to see what's going on in there.
Yeah.
Meanwhile, their SI joint is out. So I see a lot of these aches and pains that are just residual that surgeons, and they have so much education, and I applaud them for that, but they're quick to put you into surgery to see what's really going on in there when it's really a functional issue of a different joint.
Exactly. They focus on the knee. They can't find anything. They want to go look in it. There's still nothing, right? Because it's not caused by or in the knee. It's caused by an imbalance higher up. So that makes sense. So that's how you fix it then, obviously. We already know the answer. Yes. So if you're frustrated, if your doctor doesn't figure out what's going with the knee, they always find something though. I see it so many, they always find, oh, you get some arthritis, or your meniscus is a little bit sprained, but often those things really don't cause that severe pain that they're suffering. So you gotta look a little bit beyond just the knee. And that's what therapists with the knowledge such as Kat can do for you. What is Evolve? Because I just got given this very nice pain relief cream Evolve. Can you explain to the clients what Evolve is?
So, you know, for many years now, I've been using pain creams. using chemical-filled pain creams, creams that burn, creams that cause people to break out into a rash, creams that don't work. So, you go to the drugstore and you spend all this money on all these creams because they, quote unquote, they're going to stop your pain. Well, that's not what they're doing. You're putting a bunch of chemicals and water on your skin and it's causing a reaction. And so I'm very involved in CBD, not just for the CBD itself, but the plant has so many compounds that people aren't even aware of.
We're talking the hemp plant?
The hemp plant, yes, sir.
Correct.
And so I said, you know what, let me see how this goes. So I use essential oils in my practice all the time. So for about a year, I took 8 or 10 very specific essential oils that affect the neuroreceptors of pain that go to the brain, combined it with CBD, with some very good carriers like coconut oil, olive oil, mango butter, emu oil, arnica, combined them into a cream and started doing R&D on it. The response was phenomenal. It would pull bruises out of the body within a couple of days. It would reduce the amount of swelling. It would cut pain immediately. And so I said, this is it. I'm not using anybody else's things anymore. And it's quick, it's affordable, and
so you put this all together, did some research, some studies on it, and now we got 100% all natural cream without any colorings, preservatives, or any synthetic ingredients.
No.
CBD oils, essential oils, and essential nutrients to help with pain, swelling, bruising.
Right.
All right, so this is mine.
That's yours.
All right, I'm going to try this for sure.
That's yours.
There's, it's unique because they're not on the market. You can't find this stuff. So I'm very excited about this. And so in your practice, you use the rock tape. You don't use this to massage? You apply it afterwards, maybe, or?
It depends on what's going on. So
Okay.
if there's a very top muscle that's not shutting down, I put it on. If I notice swelling off the bat, I put it on. If I'm doing something that's causing some irritation, like they're getting a little bit sore, I put it on. But it's on everybody.
So it's soothing, it's damping, it's making everything hypo.
Right.
Anything that's hyper, it's making it hypo. Okay. How would massage therapy, and that's more like of a personal question too here, how would massage therapy help the athlete?
Oh gosh, athletes.
Because I know I've seen it on Facebook, you've worked with athletes, triathletes. I've seen you on early mornings in the weekend setting up your booth and getting ready to help athletes. So tell us a little bit about that.
Yeah, I'm big on human performance and human movement. Athletes are a very different type of animal, and you're going to agree with me with this. So athletes are going to push themselves to 100% of the limit, right? And the pain they experience, they're not realizing that they're changing things and they might be aggravating things, but they're so strong that other muscles will take over, right? So like
compensation mechanism.
Right. So I know you had shoulder issue at one time, right? And so somebody who has a shoulder issue, an athlete, their muscles are so strong surrounding that shoulder that they're not going to realize they have an injury. So working with athletes is amazing. They get amazing results, first of all, because usually their nutrition's on point. If you're an athlete, you know what you're supposed to be
Should
doing.
be. Yeah.
Should be. Your hydration is usually on point. And then you work out. And so working with athletes, it's more of changing that fascial system. So it's not necessarily that muscles are tight on them, it's more of the fascia surrounding them that's contracting that muscle and they're not getting blood flow. That's why they're having extreme soreness. So I love working with athletes because I'm able to increase their performance. I'm able to, when I trained at the NFL Prep Draft Center at XP Sports in Boca, it was amazing that with the training they were receiving from athletics and then the sports massage they were getting every day, they were increasing their 40 by, a couple of seconds here and there, but that's huge. That's
of course, on that level,
so huge.
It's amazing.
And so, increased performance, decrease muscle soreness. You're going to cut the swelling. You're going to prevent them from getting injured. That's the biggest thing, because if you're going to sign a $40 million a year contract and then you get injured, now what?
Exactly.
So working with athletes is a very special.
So the athletes get it preventatively on a regular basis, and also when there's something going on.
So all the time, they should get, very specific before season to get their body ready to go ahead and start doing those corrections. In season is more like keeping them maintained, and then you have your after season as well,
which you fix and get ready again.
Right.
All right. Very interesting. If there's a local athlete here and they're interested, obviously they can contact you, but how often would you suggest they come to you?
So if there's no issue, if they are not in a flare-up or there's not an acute issue, so let's say they're an acute issue, I would say a couple times a week.
Yes, to get it resolved.
To get it resolved. As soon as it's resolved, a couple times a month.
Okay.
But that's, when you're in season, it needs to be consistent, at least once a week, twice a week.
Once a week when you're playing.
Constantly.
Yeah. When I was training for that world record last year, I went to the gym twice, but it was awful. Thanks, that's all. And then I went swimming 3 or 4 times, and that's a lot because it was very intense. So the body needs to recuperate in between. So when it came closer to the world record, I tried to get 2 massages in, and it was most like I want to be ready for my next workout because I was so sore, and how am I going to perform the next workout? Right. So it's more injury prevention when you're competing at that level, I think.
Yeah, 100%.
Okay, the interesting differences that I learned today is you're really focusing on myofascial versus let's relax these muscles. Right. Or let's get the lactic acid out of the muscles. You're really focusing on doing what? Explain a little bit more than myofascial to the listeners. What is a fascia?
So the fascia is kind of like, so when you have that chicken breast, and then you have that thin layer of skin that you can lift up. So that is similar to our body. It's fascia. But fascia encompasses the entire body: bones, muscles, tendons, nerves, everything.
That's how everything's connected.
Everything is connected. It's kind of like a spider web on the inside of the body. And so when that fascia gets tight, it can pull. It pulls, it restricts, it can cause muscle cramping, postural.
It gets things out of balance.
100% gets things out of balance. So if you don't start releasing the fascia in the body, you're kind of wasting your time
working on the muscles.
Because you're not going to get to the muscle.
No.
You're just going to cause muscle injury.
Very interesting. I also see, again, massage therapy as a preventative, right? We talked about it a little bit in the beginning. We can come to you when we have chronic pain, when we have functional issues, but I look at it from an immune system and a circulation system. I think, competing at that high level is certainly not healthy. That's another discussion. But when we talk about health, it's about movement. It's about circulation and oxygenation, right? And so things like massage therapy, besides always going for this long beach walk, will really help moving things along, right? Moving the toxins, releasing the toxins, and getting things flowing in the body. Anything else you can think of that may be a reason to come and visit somebody like you? Besides the chronic pain, preventative measurements, getting the blood flowing, getting the lymph and immune system flowing. What else?
I trained with this amazing massage therapist and Dr. Eric Dalton, and he says that, Americans live in a flexion-driven society, and that's 100% true because, we sit at our desk and we're on a computer, we are driving, we read, we're on our phones. Everything is flexion-driven. Everything is forward.
Our head's forward, our body's forward, so everything gets short in the front and gets weak and overstretched in the back.
Right. And so if you don't have some sort of maintenance plan to counteract our poor posture, our poor movements, it's disaster waiting to happen. So maintenance is basically just to kind of realign the body and to get, fresh oxygen and blood flow to all the cells, to all the muscles that need to function properly.
Very good. Now, when you do the massage and we talk about flexion extension, now, do you also give people like extension exercises to do at home?
For sure.
Okay, good. So you do prescribe exercises and corrective postures for people to do at home, because I can see if you come once a week, that's great. But when they sit in their car a few hours a day because they're a medical rep or something like that, they really need to be educated on proper posture in the car, adjusting their working station at home and things like that. So you do those things too?
Right. And I also do functional mobility classes at a local gym.
Okay.
Teach foam rolling, we use lacrosse balls and bands. So really trying to teach people at home, how to correct themselves, because I only have an hour with you and you have 23 other hours.
That's right. So they become important.
Right.
All right. So it's all about education. Is there anything else you want to share with our viewers today?
No, I think that's it.
All right. How can they contact you? What's your website?
My website is www.nwpowerhouse.com.
NW Nirvana Wellness Powerhouse.com. So nwpowerhouse.com. That's easy. And you're located in Palm Coast. The website, I assume, has your contact information,
Yes.
your phone number, and stuff like that. Again, there's massage therapists out there, and then there's massage therapists out there. So it depends what you're looking for. If you just want to have a feel-good massage, you probably can go anywhere. If you really want massage therapy to help you with your chronic pain, increase your athletic performance, you need somebody who has the knowledge, the understanding, and the certifications to really look at the things that a doctor doesn't look at, which is many times the cause of a musculoskeletal problem.
Right.
Did I say that right?
You did.
All right, very good. Thanks for listening. I'm going to contact her too, because many times we don't even know on how we can improve performance and how we can get more flexibility with this myofascial train, I call it then, right? So thanks for listening. Hope you learned a lot. And always remember, choose health freedom. Now I think now we can say what we want. That was good. I liked it. It was good.
Awesome.
Yeah. See, people don't know that, right? I even only know half of it. So
Yeah.
that's true.
People don't, and they've been scarred by other massage therapists, because I don't believe in deep tissue, the coin term deep tissue, because deep tissue is, what is that? You know what I'm saying?
Yeah.
Deep
It
to
means
what?
I'm going to put a
I'm
lot
going
of
to hurt you.
Yes.
Right. So
Yes.
they've been scarred by that. And, I can't do that. Or they've had a trauma in their life. They don't want to, get undressed in front of somebody else. Or they just don't know. They just think it's
No,
massage
they don't.
therapy, and they're like, I don't want to do that.
No. So this was good. I think it's not too long. I think you could use it.
Awesome.
I'll put it on. Yeah.
Thank you so much.
No, you're welcome. Hopefully you get some people out of it.
More people than I need, yes.
But even on your website, it would be maybe,
It'd be
I
awesome.
mean, you decide, but maybe it would be a good educational tool too.
Yeah,
And anytime you want to come back to talk more specifically about whatever you're doing, you're welcome. Even if you want to introduce something, I'll tell the local people that it's sitting here. Just use it if you want to.
Awesome. I appreciate
Yeah, no
it.
problem.
Thank you so much.
No, you're welcome. I'm glad you're doing good.
Yes, come along.
Yeah.
I'm expanding actually in December.
Expanding where? Wow.
Well, I need a bigger facility.
In Palm Coast?
Yeah. I need a training area specific, and then I need multiple ones. I have 2 now. So I have a therapist that I'm coining that graduated last year. I'm bringing him on, but I want other disciplines in there as well. And it's getting to the point where I'm getting 2 new clients a day. So I need to,
Wow, look at you.
yeah.
That's good.
Yeah.
Oh, wow.
8 to 10 people a day. It's a lot. So I need to be able to outsource people who call me from the internet because I take referrals only. I'll see you if there's a problem, but if you want feel good,
Yes, exactly.
So I would like to be able to have a business where they call and I can schedule them in the facility, but for another therapist or acupuncturist.
Yeah. Very good. So you're looking at a facility over there? Do you have an idea?
No, not yet.
Okay. Good. I know Russell here has a lot of space that he wants to rent out.
Yeah.
Let's see, one across the street, these bodies.
Oh yeah.
Yeah.
Well, thank you so much for having me.
No, it was fun.
Can we throw some of this cream on you before I go?
I don't know when I'm hurting, but you want to put it anywhere?
You have a pain somewhere specific?
No, not really.
No?
I'll keep it for when I am.
Okay, that
But I'm
works.
gonna try it. I'll try it on somebody who isn't can too.
Yeah.
And then where can people buy it online, or where can we get it?
Yeah, we can do it online.
On your website?
Not on my website. We're trying to develop that right now because it's a real sticky
Uh-huh.
situation with the government and massage
Uh-huh.
therapists. So
So ridiculous.
yeah, so we're having to come up with a sister company. But yeah, they can contact me. I can ship it right now.
Okay.
Actually, I'm coming up with a 2,500 milligram one for athlete performance specific. So
That's
that'll be ready.
milligrams, not bad.
Yeah.
Well, how many? Yeah, normally it's milligram per ml when we're talking about the liquid, right? So it's all relative from 1,000 milligrams
For the
per what for the entire
the
thing.
entire
But still,
liquid,
yeah, it's
yeah.
still a lot of small jar.
yeah.
So that's good.
hmm
All right.
Awesome.
Where did you go? Where do you get the CBD ingredients?
I flew out to Colorado in January and went
Organic
to
hemp.
4 different farms.
Is it just CBD or is it the full spectrum in there?
No, CBD and the 2,500 milligram will have CBG in it. We're also
I
coming
was
out.
gonna just ask, CBG's getting.
Yeah, CBG's been out for a while, and then we're also doing CBN. CBN is a huge neuro like sedator kind of, and so we'll be putting that into our dreamscape for like maybe spa. And so there's a bunch of other compounds that we're playing with right now for pain specific.
What's the cost and the retail? Do you
I-
plan to have it in other offices or health food
Yeah.
stores?
Well, we have it in medical offices right now, chiropractors' offices. So we're trying to get into other, like stores. It's just hard because they already have so much crap in there.
I know it doesn't take much space. Plus, I just interviewed Mitch for the second time too. He owns the Golf Love Whole Foods Sport Orange in here.
Mhm.
It's the biggest one. You know the Whole Foods.
Yeah.
Yeah. I know the owner pretty good. He was on yesterday.
Oh, nice.
So
Yeah,
get
we
me
have
some. I'm here to help. Get me some info on it,
Yeah, for sure.
and then what their cost would be,
Right.
and what the suggested
Yeah, we
retail
have
is.
distribution and
Because they always go by, like you said, shelf space. It's
Yes.
shelf space that's important to them.
Yes.
But if you stack these up, it doesn't take much
Exactly.
space, right?
No,
I mean,
but
seriously.
still, yeah. And we're coming out with a whole skincare line too for like burns and so it's coming.
Very good.
Yes, yes.
I'm proud of you.
Thank you. It's
Yeah,
coming
good.
along. I'm trying to go to med.
If you're interested in any of them, just pick one.
Yeah?
Yeah, sure.
I already have your Health of Life.
Oh, you do.
Yes.
Fibro.
Yes, I'll probably take that one. I have a lot of patients with fibro.
Yeah. And again, see, because now I learn every day too, right? That's the good thing about this. So we should have put something in there about myofascial and stuff. There is a whole chapter on functional stuff. So you
Oh my
like that.
God, that's awesome.
You like that part. So we can help each other with this too.
Yeah, for sure. Thank you so much. I'll put that for you. Perfect.
You can have that too. That's kind of more for your entertainment when you were on.
Is it?
Yeah.
Thank you so much. Thank you. You have to let me know when you start doing your talks again.
Yeah. Well, just this whole COVID, you know what it's supposed to go to the seminar, right? So I'm just.
I'm glad to really remember to train. Well, thank you so much. Yes, sir.
And I'm going to come over.
Yes.
Uh,
And that's good.
Yeah, I'll make sure I'll get that whole assessment. Yeah, say.